Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 16 Homeopathic Remedies for Flu. What is flu or influenza? Flu is an infective disease of respiratory system caused by influenza virus that attack nose, throat and lung. This is the picture of influenza virus. How many persons die in flu on an average per year in India? Many think that the flu is a very common disease and everyone can ignore it. But mind this, no, not that. On an average, about 1,20,000, 27,000, 1.27 lakhs, 1,27,000 persons die in India every year in flu. How does flu spread? Droplets arising out of sneezing, coughing, laughing, talking, crying and singing of an infected person. Flu spreads. Besides, flu can spread also from virus residing on smooth surface of doorknobs, tables, buttons of leaf, mouses, keyboards and computer, etc. It can also spread from hugging, kissing and other close contacts. Just below, the image of how it spreads has been shown. On the right hand side, two main type of flu has been demonstrated. One is swine flu, another is bird flu. When the swine flu is caused by H1N1 virus and bird flu H5N1. Of the two, the bird flu that is H5N1 virus caused by H5N1 virus is more dangerous than swine flu because it attacks the lung tissue, whereas H1N1 that is in swine flu, the upper respiratory tract is infected. What are the signs and symptoms of flu? Number 1, fever or feverishness. Number 2, sneezing, cough. Number 3, throat pain. Number 4, blocking of nose or watering from nose. Number 5, headache. 6, body ache. 7, weariness. 8, occasional diarrhea, vomiting. What are the complications of flu? Bacterial pneumonia. Starts with viral, then it goes to bacterial pneumonia. Otitis, that is inflammation of ear, otitis. Sinusitis, inflammation of sinus. Aggravation of existing chronic diseases like worsening of diabetes, asthma, etc. Difference between cough and cold and flu. Cough, cold and flu, the difference. The headings are signs, symptoms, flu, cough and cold. Just on the left hand side, the symptoms, the heading of the symptoms are given, and on the right hand side, whether it is present or not, or what is the onset of the step, that has been given. Just as an appearance of disease in case of flu, sudden. Cough and cold, slow. Fever, present. Cough and cold, absent. Body ache, present. When present in flu. Cough and cold, almost absent. That is same. In this way, you just note the differences. It is just difference, nothing to be more clarified. So you just simply read it. How long does flu stay? Generally, flu stays for 2 weeks, but in special cases, it may stay further. Who are predisposed to flu? Besides children, senior citizens, smokers attract flu most. Nevertheless, any person of any age and any sex may be severely attacked with flu. How can flu be prevented? Number 1, get flu vaccine each year. Restrict smoking. Use mask. Wash hands often. Stop repeated touching of nose, mouth, eyes with palms. Maintain social distance. Avoid infected person. Can flu attack even after vaccination? Yes, because immunity wanes with time. If vaccine is not taken in time, flu can attack again. That is Actually, it should be taken each year. How to manage flu? General management. Number 1, get adequate rest. Number 2, give subjects enough nutritious liquid food. Number 3, stop smoking. Number 4, encourage to take warm drinks. Number 5, sponge whole body with warm water. Aconite for flu. Sudden attack of fever with chill. Pulse throbs violently. Subject fearful, anxious, restless. Needed when cold dry wind, especially when chilling northern wind blows. Eupatorium perforatum for flu. Severe aching in limbs and backs, as if bones within had broken due to pain. Movement not possible. Pain in muscles and bones so severe that simple touch is intolerable. Bursting headache, tremor, chill in back between 7 and 9 am. Eyeballs are sore. This symptom is also available in bryonia and gels. Mind this, the symptoms underlying are the most important guiding symptom for selection of remedy. Pyrogen for flu, severe palpitations, severe restlessness, pulse fast or slow, rate of pulse and body temperature, normal relation altered. This is most important for pyrogen selection. Mind this, standard temperature is 98 degree Fahrenheit or rather 37 degrees Celsius around that thing, and pulse rate is 75. Generally per degree Celsius 10 pulse rate per minute increases. This is standard. But here when pyrogen is required, you will see that the temperature may be 100, not 37, say 40, 3 degree or 4 degree more, but the pulse almost same, 75. Or rather reverse, the pulse is 120, 30, but the temperature is 38 degrees Celsius. That is just 1 degree. So per degree 10 beats per minute increase pulse. This is normal rate. This relationship highly altered. It may be, pulse may be fast, may be slow compared to the temperature of the body. High temperature, low pulse, just reverse. High temperature low or low temperature high, both. Feel so chilly that even fire cannot lessen it. Headache so severe that sensation as if it would burst. Better from movement or while in swing. Chalcedonian in flu. Flu during mild winter as if chill and flow of heat chasing one another. As if chill moving first up and down in waves from sacrum to occipital bone along the spine. Along the spine, these waves of chill and heat are running in waves from sacrum to occipital. Pain as if head would burst. Pain comes from neck and moving along the scalp, settle over forehead before passing, better from passing profuse urine. This is very important symptom of thalassemia. Subjects fully thirstless. Maxwell for flu. Profuse fetid sweat with flu. Severe halitosis. Halitosis means bad breath. Malodorous saliva secreted profusely. Sweating does not give relief, rather troubles increase. Illness goes down from throat to windpipe and finally to lung, that is from above downwards. Brahmi alba for flu. White coating, craving for cold water. Phosphorus is also there, same symptoms. Worse from slight movement, noise, dry heat. Like to lie down still alone. Stitching pain in chest, headache. All troubles better from pressure, but worse from movement. Pain felt in head when coughing. Subject anxious about their professions, dream about, even talk of profession in delirium, says want to go home, sitting at home. This is some sort of delirium actually. Baptisia for flu, sudden attack. Soon state reaches the stage of deep typhoid, high temperature, face dusky, state comatose. While answering, lost into sleep. Intense diarrhea with flu and vomiting. For gastric flu, this remedy is almost specific. Actually, that intense diarrhea with flu and vomiting, this is combination. This combination is called gastric flu. In flu pneumonia, when patient lies like a log, patients lie like logs, furious fetid odor comes out of their mouth. Administration of bacteria 3x in high frequency brings them back shown to normalcy. Rustux for flu. During starting of movement, limbs joint appear stiff, painful as if paralyzed. Then during motion, the problem are diluted, but then body becomes too feeble, subjects obliged to take rest. Now comes restlessness, uneasiness. Then they again start to move, cycle initializes. That is the problem. When starting movement, there is difficulties. Then normalcy. Then body is weak, take rest. Again the cycle start. Trouble starts from cold, wet weather, catching cold while in sweat stage. Dalkamara also we get the same symptom. They are anxious, fearful, restless, feverish, thirsty, tired, especially at night. Sometimes they weep in fear, thinking that one would poison them. Assert for flu. Frequent sneezing, secretion from severe rhinitis, acrid, watery excretion from nose and eyes, chill and heat flow alternately, repeated dry cough, pressure feeling in chest, which gets worse in open air, swelling of face and lower eyelids, thick white coating on tongue, tip and sides are red. Camphora for flu. Flu during soft spring starts with chill, face appears as pale as dying person, body cold but covering is intolerable, tongue cold, swollen and trembling. Causticum for flu. Start with severe weakness of limbs and partial paralysis, complete aversion to food, nose blocked fully at night, watering during day, sneezing again and again, worse in morning with neuralgia of face. Neuralgia of face, neuralgia of face is actually it's caused by trigeminal nerve, fifth cranial nerve, trigeminal nerve. It causes neuralgia of face. Very, very excruciating pain. Some says that this is the most painful disease of all. Pain, and it is known that is called also a suicide disease. There is many person commit suicide due to pain. This trigeminal nerve pain. Too much acute pain. Arthritic pain in extremities, worse in evening during cough, feeling as if there was ulcer in lungs. Sabadilla for flu. Furious spasmodic sneezing in open air and watering from eyes. Profuse secretion from nose to head as if blocked. Mild cough, hematemesis, bleeding through mouth. Cough with blood, especially if subject lie down. Tonsil swollen, trouble move from left to right. Pain felt on empty swallowing, as if throat tied with a rope. Troubles worse in cold weather at noon and in evening. Phosphorus for flu. Larynx and trachea get damaged from flu. Subject is unable to speak at all. Dry, titillating cough along with heaviness in chest. Worse in evening and before midnight. Fluid secretion from nose sometimes increases, sometimes stops. Incessant sneezing, empty feeling near stomach and fainting, painless diarrhea. Spigelia for flu with neuralgia face. Neuralgia face I have already mentioned. Now this look at this image. This is trigeminal nerve, fifth cranial nerve. It is coming out from the head, cranial nerve. It has got three supply. One is towards this above the brow line, another is to cheek, and another down the lower jaw. This trigeminal nerve, when inflamed, causes serious and severe facial neuralgia. Is another name is suicide disease, since it is the most painful disease of all. I have already mentioned this. So flu with neuralgia face. Abundant fluid comes from nose with dry heat of the body but no thrust, headache, hoarseness, uneasiness around heart region, dry hard cough at night with breathing difficulty which gets worse when subject slant forward. Particular cough or flu. Flu with problem of digestion. Watery thin secretion from nose. It goes on increasing till nose blocked up totally. Unable to breathe through nose. Difficulty in swallowing. Dry choking cough arising from titillation of larynx and dryness of pharynx. Weakness of function of heart. Stricta pulmonaris for flu. No trouble in the morning. Mucous membrane of nose very dry, painful. Cannot breathe through nose. Worse in afternoon, better in open air. Heavy sensation in the forehead and in the root of the nose. This is heavy sensation in the forehead and at the root of the nose is one of the topmost guiding symptoms of stricta. Soft palate as if dry piece of hide. Difficult swallowing, incessant cough over whole night with heavy sensation over the chest and from titillation of larynx, choking cough, continuous sneezing, heaviness in the right side of the forehead extend to the root of the nose.